Hello, good morning. Today we'll be talking about diet changes that are required for end-stage renal disease patients. There are different types of diet for kidney patients. We don't have the same format everywhere, but for dialysis patients, reasonably highs and lows are usually expected. And the expected changes is what I'm going to tell you. But there are definitely some patients who have some exceptions, and that your own nephrologist will be going through those things with you. For a dialysis patient, for a person who is coming towards dialysis, we mention them to eat maybe normal amount of protein diet. But for dialysis patients, we do recommend eating a bit high amount of protein diet. What do you mean by high amount of protein? We liberate you a bit from the non-vegetarian side to eat a little more poultry, chicken, eggs. We also ask you to eat dals, lentils, millets, all these forms. We do recommend not eating mutton or beef or pork or camel only because that has a little bit of higher phosphate intake and also has more cholesterol and not usually considered recommended for heart healthy diet and for kidney healthy diet. So, what comes after this? After this comes two important forms. One may be low salt diet, salt restricted diet. That is the same thing for everybody. You can say it can be pure form of vegetarian, but if you're eating at least a bit of pickle a day, then you're obviously uh, slipping away from the low salt diet. So make sure you have only 2 to 3 grams of salt per day. So along with that, we have water. Water also has to be restricted. Take a little bit smaller glasses of water. Have some small glass at home. Make sure you have a bottle, separate bottle that you have to use but throughout the day. And even in that bottle, partition it separately so that you have some water to drink while you're taking your medications, and then you have some water to drink for the rest of the day. So what comes next? Next comes potassium. So potassium diet, you don't have to follow it as strictly as you did before going to dialysis. Especially when you're on 3 times a week dialysis, you can liberate yourself a bit in the potassium point of view. But even in those cases, there are some patients who tend to get higher potassium values, even with 3 times a week dialysis. And for those patients, especially, we definitely tell you not to eat oranges, not to eat bananas, and not to eat coconut, not to drink coconut water. So, if you are a person who is already following a low potassium diet and still have high potassium, there is a process called leaching. Leaching means you take your vegetable, especially potatoes and stuff. Take your vegetable, put it in water, soak it in water for 4 to 6 hours, and then remove it, and then slice it and eat it. Or some people actually dice vegetable first, boil it in 15 to 20 minutes of water, and then use it for eating. So those are some techniques that you can use. The other restriction that we do impose on patients with dialysis is a low phosphorus diet. A low phosphorus diet, in the sense, we ask you not to eat dry fruits, we ask you not to eat beans, and reduce the amount of dairy products that you're on. So, what can I eat? Is the final question. For patients who can eat good vegetables, some are uh, rich gut, body gut, snake gut, uh, all the regular vegetables that you can eat, brinjal or cucumber or beetroot, pink radish, and the leaves. You can also eat some fruits like papaya, uh, pineapple, watermelon, little bit restricting your no diet, and that time watermelon, apple, and guava. So I hope this has helped you guys in some way as an outlook, and hope you feel better, you eat better, or you eat better and you feel better.